Definitely feel very stressed.
I've never felt so much stress in one school year.
I didn't want to get out of my bed today. I really didn't.
Kids have been struggling for a while, and we can no longer wait to address youth mental health in our country.
Now that the pandemic seems to come to an end, things will get back to normal. No more crisis to handle, right? Not right. While you are scrolling through your mobile phones, one of the world leaders, the United States of America, is amidst an ongoing crisis. Yes, you heard that right. In 2021, youth mental health was declared a national emergency by pediatric experts across the United States of America. The announcement addressed the effects of the COVID-19 pandemic on children and young adults of the nation, leading to a youth mental health crisis. Do you want to know more about it? Well, we are here to help you with that. So sit back, relax, and let your mind feed on some information. Let us discuss why America is facing a youth mental health crisis. As the country completes its 2 years tenure of the pandemic, mental illness cases and the need for psychological services reached an all-time high. Components like remote learning turned out to be fruitful for some children, while for others, it resulted in mental health issues. US Surgeon General Dr. Vivek Murthy issued a new Surgeon General's advisory to highlight the urgent need to address the nation's youth mental health crisis.
Struggling with your mental health does not mean that something is wrong with you, and it's not your fault. We have to normalize that. We also have to let kids know that it's okay to ask for help.
You might be wondering, what is the youth mental health crisis? Well, American kids and young adults are suffering from mental health disorders. Most of these are on account of the trauma due to episodes like child abuse, negligence, and family issues that erupted during the pandemic. While the loss of a loved one during the pandemic was a major cause of depression among adults, children too paid a mental toll. The anxiety about the coronavirus and a restricted routine added to the turmoil. These issues caused an increased number of mental health disorders among the American youth, which took shape into a youth mental health crisis. With all these situations at play, the need for the mental health resources is an urgent concern in tackling the ongoing crisis.
People feeling alone, I guess, like they don't really have that many friends, or they feel like they lost a lot of people.
Every classroom is filled with kids going through issues that hinder their ability to learn and focus. This is not just harmful for their academic performance and future pursuits, but also a threat to their lives. Mental health problems in the US have taken the form of pervasive illness that have resulted in the country ranking as the nation with the highest suicide rate among developed nations. Before the COVID-19 pandemic, mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children aged between 3 to 17 in the US having a mental, emotional, developmental, or behavioral disorder. Additionally, from 2009 to 2019, the share of high school students who reported persistent feeling of sadness or hopefulness increased by 40% to more than 1 in 3 students.
In a 2009 study conducted by the American Psychological Association, nearly 45% of high school students were found to be stressed out by school pressures. That is nearly half of all students in the nation.
Suicidal behaviors amongst high school students also increased during the decade preceding COVID, with 19% seriously considering attempting suicide, a 36% increase from 2009 to 2019, and about 16% having made a suicide plan in the prior year, a 44% increase from 2009 to 2019. Between 2007 and 2018, suicide rates among youth aged 10 to 24 in the US increased by 57%, and early estimates show more than 6,600 suicide deaths amongst this age group in 2020. The pandemic added to the pre-existing challenges that America's youth faced. It disrupted the lives of children and adolescents, such as in-person schooling, in-person social opportunities with peers and mentors, access to healthcare and social services, food, housing, and the health of their caregivers. The pandemic's negative impacts most heavily affected those who were vulnerable to begin with, such as youth with disabilities, racial and ethnic minorities, LGBTQ+ youth, low-income youth, youth in rural areas, youth in immigrant households, youth involved with child welfare or juvenile justice system, and homeless youth. This fall, a coalition of the nation's leading experts in pediatric health declared a mental emergency in children and adolescent mental health. The flawed mental health care system is being held accountable. The American Psychological Association testified before the Senate Health, Education, Labor, and Pensions Committee on the youth mental health calamity. They engaged in addressing the fundamental flaws of the mental health care system. According to the Surgeon General's advisory, the mental health problems faced by children and young adults directly reflect their biopsychological abilities and surroundings, including social media, schools, homes, and other extended environments. The mental health care system is still following the ancient World War II setting, where the investment is focused on treating veterans, now adults. The system is adult-centric, and there is a gap between the existing mental health care facilities and the children's mental health care needs. So, what's the solution? The approach to training psychologists need to be re-examined and reprogrammed. There is a need to invite more investment in the mental health care sector, from research to medicinal developments and dedicated healthcare facilities for children's mental illness. The current investment in the mental health care sector for children and young adults is 1/500th of the total investment received in the medical avenue. This results in a small corps of providers overloaded with patients and referrals. There is a need to spread more awareness about the cause and tackle the stigma around mental health issues. Both psychological and physical health models need discrete systems. More evidence-based study practices need to be promoted to improve patient outcomes. Empower youth and their families to recognize, manage, and learn from difficult emotions. Ensure that every adult has access to high-quality, affordable, and culturally competent mental health care. Support the mental health of children and youth in educational community and childcare settings, and expand and support the early childhood and education workforce. Address the economic and social barriers that contribute to poor mental health for young people, families, and caregivers. Increase timely data collection and research to identify and respond to youth mental health needs more rapidly. This includes more research on the relationship between technology and youth mental health, and technology companies should be more transparent with data and algorithmic processes to enable this research. America working towards improving the mental health of their children and young adults is a dynamic process. America is hosting numerous clinical trials and mental health awareness programs for its population. The nation is taking a dedicated stride towards helping children and young adults deal with their mental health crisis. Children and young adults in the nation face acute psychiatric conditions that further indicate underlying diseases like schizophrenia and bipolar disorder, anxiety, or depression. The high schools and middle schools are trying to keep up with regional and federally funded mental health clinics to support their students who are experiencing psychosis. This initiative will offer more inclusive space for their students to address their vulnerabilities and seek professional help. Moreover, teachers and administrative staff are also being trained to attend to students facing mental health conditions. Altogether, more investment better healthcare facilities, and increased awareness in the sector will offer more opportunities to establish a well-maintained mental healthcare system. The youth of the nation is its most prized possession, and currently this possession needs to be safeguarded with medical and economic strategies to deal with the youth's mental health crisis. Hopefully, the recent emphasis on the issue will give better results and a brighter future for American children and young adults. But do you know what will give us a brighter future? Your support. So, you know the drill. Comment your views, like our videos, and share them with fellow enthusiasts. And until we meet next, stay curious, stay awesome. Volt of Vokes signing off.